He said, I have to be perfectly candid with you. He said, after 30 years of having taken care of my wife, he goes, I sat down the other day and I felt how tired I really was. So when you take on that responsibility of a caregiver, it's something that's very, very difficult. And it's something that you do have to take breaks from here and there. And as always, eat properly, so forth and so on. And hopefully people will do that, but not everybody does. They get caught up in doing what? Being a caregiver. So it's important to pay attention to that, because in many instances, many of you may become those caregivers for your family. So people oftentimes say to me, my goodness, Mark, how expensive is long-term care? And I say to people, well, when I first started in the industry, I started with IDS, which was the training ground for financial advisors. It was part of American Express when I went on the personal side. We used to talk about purchasing $100 a day long-term care benefits as if that was some sort of a big number. Today, there are some policies that will offer you the opportunity to buy individual daily benefits up to $500 a day. Sometimes also having inflation riders attached to those contracts if you wish to do so. But let me tell you this, you're going to pay. These products are much more costly than they ever used to be. Why? Because the actuarial assumptions that were made about these products, they egregiously missed the mark. Most of these facilities are far more expensive today, and the cost of medicine and medical care has skyrocketed over the last multiple decades. It has far outpaced the cost of general inflation. So as you can see here, this is the US median prices as of 2021. Private nursing home room bottom, $297 per day. That's not in the New York metropolitan area, I can tell you that for sure. You can double that or double and a half that. So these costs are real, and they're things that people need to think about. And if you have to use these types of facilities, where will you do it? For many of you, it may mean that you're not living in the New York metropolitan area, you're moving someplace else, because there is a tremendous divergence in costs. Important to understand that. So one of my key questions that I always like to ask is long-term care insurance coverage in your future. Well, what does it do? It assists people with chronic illnesses, disabilities, and any other conditions which occur on a daily basis or over an extended period of time in which they need help. They need some assisted care for simple activities or what we call activities of daily living. Okay, and some of you may need it from nurses and therapists and other professionals. So it ranges. That's why we talked about those levels before. But here's the key piece, and I say this to everyone when we talk about long-term care insurance. Policies offer many different coverage options. Please read the specifics. One company calculates benefits one way, another company calculates benefits a completely different way. Some may be a daily benefit, some may be a monthly benefit. How you accrue your daily benefit may be done in hourly increments. So for example, every hour, anything between 0 and 2 hours gets 2 hours automatic. Anything between that 0 and 4 hours, if it was 3.5, difference between 2 and 3.5, you get 4. Well, why is that important? If your daily benefit's based upon 8 accrued hours, it might take you 4 days of 2 hours each day to accrue one benefit day. So it's important to look at the specifics of these products. And then lastly, your age, your health, and the assets can impact the cost of your policy, but primarily it's going to be age and health. So if you're looking or considering long-term care, especially for those of you that are working in the corporate environment, see if it's available through your companies, because in many instances it's subsidized or you're getting group rates that are better. So please pay attention to those opportunities. After all this stuff, it brings up something that I call the important question. Because as you can see from this particular slide, and one of the things that I tell people when I finish the Retirement Income Certified Planner curriculum, these were all the different things that people typically were asking me over time. Am I going to need to have assisted living issues in the future, like long-term care, or do I need to have assistance with my finances? How much security am I going to have, and what do I need to do to put those things into place? What kind of a living environment am I going to have? Am I going to be active? Am I going to be completely coherent and able to enjoy my retirement? Or am I going to need to give care or get care? Did I save enough? Will my golden years truly look like golden years? Did I put enough in my 401k and my IRA? What about Medicare? What about long-term care insurance? What about my social activities? So there's a lot of things that go into planning for retirement and a lot of things to think about when we get there. But before you do that, I always ask people, think about what it'd be like 10 years from today. What does your future look like? What potential issues may you have to face? I tell people, always think ahead. You can't tell what the future has in store for you. But one of the key questions, if you're going to start to plan for estate planning especially, how will you prepare for long-term care? Because I guarantee you that your estate planning attorney, that's going to be one of the first questions that he asks you or she asks you. Have you discussed it with family as well? Critically important. Understand who's willing to take on those roles and responsibilities and how much of a commitment it is. And then lastly, do you have a game plan? Because if you don't have a game plan, the worst thing is having to come up with a game plan at the last conceivable moment. We don't want to do this on the fly, folks. I tell everybody, if you're going to do this yourself, do your homework and do a lot of it. Because purchasing long-term care insurance is an incredibly important financial decision. Do your research. Understand the differences between different companies. Work with a reliable company and an agent that you trust that can explain these elements to you. Seek references. Make sure that you're working with people that make you feel comfortable. As I often like to say, if your car broke down in the middle of the night and you were looking around and you said, I'm someplace I don't belong and the hair on the back of my neck is standing straight up, do you stand there and continue to ask questions, or do you get out of there as quickly as you can? Get out of there as quick as you can. If you don't feel comfortable with someone you've sat down as a professional, and you don't feel like they're approaching you in that manner, and the hair is going up on the back of your neck, please do me a favor and walk out. Professionals don't make you feel that way. But all these decisions, when we talk about long-term care, where do they start? Right here, Medicare. Why? Because people have this fallacy, a belief that Medicare is going to provide long-term care coverage. Medicare provides limited coverage, first 20 days, that's it. Eligibility is based on a hospital stay of at least 3 days and many more for long-term care assistance. As I said, they're going to cover up to 20 days of long-term care assistance, and they'll partially cover up to an additional 80 days, and then it is done. That's it. Medicare is out of the picture. As you can see, same thing right here. The only difference is age or days 21 to 100. The individual pays $105 per day. Medicare will pay the difference. But once you hit 101, Medicare is not paying anything, folks. It's important for you to completely understand your options in the ranges of care that's available to you. Use the online resources for guidance and research. If you're not familiar with where to start, please send me an email. I have a resources list of all the different websites that have guides, everything from AARP to the numerous different state agencies. So you'll have a whole plethora of information available to you on long-term care. And SOFA just definitely recommends, if this is an area that you're not familiar with, please seek out a competent financial planner or an insurance agent who specializes in this area. It's critically important for you to do so. Lastly, how much will you need for long-term care? Well, that really depends on you and what you want it to do. I'll give you a perfect example of a client who it really didn't have a great need for long-term care insurance. They're very wealthy individuals, basically 10-figure net worth, but This individual was always worried that her children and grandchildren, because they seem to be very monetarily oriented, would basically look to put her in the cheapest institution that she could possibly be in. So she said, I want to make sure that that doesn't happen. And she bought the Cadillac of Cadillac policies to make sure that if she does have to go into an institution, it'll be the one of her choice. Lastly, the biggest issues that you face with long-term care is unpredictability. You have no idea when or if it will hit you. Your best game plan is planning as if it happens tomorrow. Who will take those key responsibilities on? Do they have the capacity and the capability to do the tasks that are needed? Sit down with the key members of your family and have that discussion, please. Determine the participation levels and expectations. What financial capabilities do you possess to pay for care? And will your finances dictate where you go, or is that not an issue for you? As you can see, folks, there's a lot of questions when it comes to long-term care. We've only really scratched the surface this evening, but I want to say thank you so much to all of you for joining me. If you have any questions, I'm more than happy to answer any of them at this point. I know we've got the chat available at the bottom, usually at the bottom of your window. So if you have any questions, feel free to ask.
Thank you so much, Mark. That was a very informative presentation. And just to reiterate what Mark said, if you have any questions, please feel free to drop them in the chat and I'll read them aloud. I have both a question and a comment, so I'll start. First, this is a comment. I really appreciate the points that you made about community care. I think oftentimes people don't consider that a community can be a part of long-term care for an elder person. It doesn't necessarily have to be like a retirement home. It doesn't necessarily have to be a nurse that's hovering over you 24/7. So thank you for making that point too. And also thank you for also saying that if you are doing community care for someone that you know personally, that it's also very important to take care of yourself. I have a little bit of a question about financial planning. Just so theoretically, when do you think someone should start planning for their later years for retirement?
It's funny. Always when people say, when should you start planning? My initial response is always yesterday. Obviously, you want to start planning as soon as you possibly can with regards to retirement. Why? Take advantage of what's called the time value of money. Let time and your money work for you over a long period of time so that you get to take advantage of the compounding over that long period of time. Critically important to do that. Once you get into your early 40s, you should be considering, hey, can I be looking at long-term care policies and purchasing them when I reach when? Early 50s. Most economically feasible, whether it's through company or whether it's through a portable policy that's outside of that. That's the greatest viability at that particular point. When you're getting about 10 years out from retirement, please run the numbers. Most of you have a 401k, 403b, 457 defined contribution plan. Not a lot of you have pensions. Run the numbers. Understand what your distribution amounts are going to be and why. Understand the risks that are associated with what I call the high-risk corridor and sequence of return risk, critical elements. Once you've done that, you can start to lay out your game plans as to the appropriate risk type items you need to put into play as you enter retirement. A, to protect your income as it's coming to you, and then what types of insurances should you have in terms of Medicare or Medigap. All those elements are things that you should be thinking about 5 to 7 years before you're ready to retire, so that when you're ready to go, all these things have already been lined up. Your strategies to be tax efficient in terms of your distributions from retirement plans and things should all start to fall into place long before you're ready to retire, not 6 months beforehand going, oh, I should probably run an analysis and see where I am. A little late to change things then. So the more in advance that you do your planning, the better off you'll be. But great question, Megan.
Thank you. And just to reiterate, you do recommend seeing a financial planner.
For those people who do not spend a lot of time and don't have a natural affinity to doing a lot of research, although frankly, I have to admit, most of the people who go to the library do what? a lot of their own research. So not all of you needs a financial planner. Not all of you need someone who is a broad-based element. You may need someone who's a specialist in the particular areas or acumen that you want to explore. Those are the people you should seek out. I know even for me, this is my 46th year in the industry. And I don't do everything. I have so many different colleagues that I will refer my clients to, or people that I meet through the SOFA events and say, you should talk to someone like this. He's a long-term care specialist, or this one's a life insurance specialist, or this one's an annuity specialist, or this one's a reverse mortgage specialist. So there's so many different intricate components to retirement planning that you need to have a good generalist on your team who understands all the things that need to be put into place and can say, hey, here's the things you've done well. Here's the things that you have some deficiencies in. And here's the areas I think you need to explore, really shoring up these gaps so that these don't become more significant for you later on.
Thank you. I see that we have a question in the chat from Susan, and she
Sure.
would like to know, how do I find an LTC financial planner in New Jersey?
You know, the interesting part about LTC or long-term care, there's not many financial planners who specialize in long-term care itself. But I will tell you this, there's a lot of insurance agents who specialize in long-term care. And in fact, many of the libraries make presentations available by these specialists in long-term care alone. Where I would typically start, if those are areas that you have a concern, start with your estate planning attorney, because in many instances, estate planning attorneys have a direct link to long-term care insurance professionals. Why? As I said before, it's one of the first questions they're going to start to talk to you about. Hey, have you talked to your family about long-term care? If it happens, what's going to happen? Who's going to take on the roles? So they're going to start to ask you about that. And typically they will have good referrals to insurance agents. For those of you that are members of Knights of Columbus and organizations like that, they have some super competitive long-term care policies. So if you have that available to you through Knights of Columbus or some of the other organizations, I tell people, as well as company benefits, explore them all, because many of them come with discounted benefits because of the fact that you're attached to those organizations.
Thank you again, Mark. And I want to reiterate to everyone, Mark was generous enough to provide us with his contact information. So if you have additional questions, please feel free to reach out to him.
Well, Megan, thank you so much. And thank you, everybody, especially as we get to the end of the summer. It's always nice to see people for a presentation in the evening. Obviously, we'll be doing a lot more in the fall. And obviously, we've got a full boat in store once we start the beginning of the year as well.